Hello everyone, this is Dr. Dan Bockmann. Again, good to see you here. I'm a chiropractor in Austin, Texas. I have a rehab clinic here and we fix all kinds of things. Today I want to answer a question. I like to do that with these videos. One of the questions sent in by our viewer is they're asking about how to prevent knee pain when running. This is a big one, and to have pain, maybe you don't have pain at all. It's only when you run. Maybe you're noticing going up and down stairs. So let's take this down to basics. There are basically two causes for pain when running, and one is your training schedule. So meaning if you're a non-runner and you want to run a marathon, then there are good sensible steps you need to take to prepare your body so it can adapt to that activity, to running longer and longer distances and faster speeds. So if your training program is bad and your ramp up angle into running is too steep, your body basically doesn't have a chance to recover from the previous workout. Maybe the dose was too big. Maybe you started with a 5-mile run and you should have started with a 2-mile walk. Kind of give your knee a chance to adapt to that, then add a little more work. So if your ramp up angle is too steep into running, you're going to give yourself, put yourself into an overtraining situation, which it's less about overtraining, it's under resting. That's what an overuse injury. It's not enough recovery time built into your workout to allow your knee to get stronger and adapt to those workloads. The other part, so it's a training issue, could be the cause when running, or it could be that your knee itself has some problems, it's not able to support and protect itself like it should, period. That could have been going on before you started running, you just didn't realize it until you started running, and then you're asking your knee to do more work and it's complaining about it in the form of pain. So a training regimen is not something we have a chance to get into today. That's its own thing. We'll discuss that in a future video. But the two-part solution that I'll give my patients when they come to see me with is we'll address their training program and we'll say, let's back off of running enough to where you're not having consistently severe pain or pain that forces you to limp or gives you big increases in pain after doing that, whatever the activity is, whether it's running or lifting weights or squats or whatever. We're going to back off long enough to give your knee a chance to recover from those things, then gradually reintroduce them. And as far as checking out your knee to see if there are any underlying causes that need to be fixed to allow your knee to run comfortably, that breaks down into two main things. You can basically have flexibility problems around your knee or stability problems. Flexibility, can my knee straighten all the way? Can I pull heel to butt and touch heel to butt easily? And those are the two motions your knee can do. It's a hinge. It can only move in this plane, so therefore it should be able to easily straighten and you should be able to comfortably pull heel to butt. If you can't, then that tells you there's some stiff, tight things in there that are preventing that and forcing your knee to move abnormally, which by itself can give you pain down the road. So if you can't straighten your knee easily, that could be tight hamstrings, that could be tight calves that are preventing that. So hamstring and calf stretches could fix that. If you can't pull heel to butt, that could be tight quads. They're the muscle that runs across the front of your knee. If they're too tight, they will prevent that. Also tight things like IT bands, which is a tendon that runs on the outside of it runs from hip to knee. That's also a real common cause, and the best fix for that oftentimes is foam rolling, and we'll talk about my foam rolling protocol in the future. And hip issues themselves. So if your hips are tight, hips are what steers your foot and leg. Knee can't steer itself. It can only do this. So basically what changes or steers your feet are hip muscles. So if your hip muscles are too weak or too tight, they can cause some knee issues as well. So the overall solution is make sure your knee has the support and flexibility it needs to run safely and comfortably, and choose a running program that allows you to advance to the distance and pace you want to run without and handling each little step of that increase without big setbacks as far as pain goes. So I know that's kind of a complex thing, but if you progress into running at a rate that all your parts can handle without big increases in pain or other disability, you're doing that part right. And then if you have flexibility or stability issues in your knee, weak things or tight things, then address those so that then your knee is prepared to do the job you're about to give it. I'll point you. I actually devised an online course that teaches you how to address the most common causes for knee pain. You're welcome to check it out. I'll put a link to that product in the description below. And if you have questions, any other questions about health or injury that you'd like me to answer, leave those questions down in the comment section below. I'd love to get to those. And as always, subscribe to us if you'd like to see more of this. Good to have you guys here. Let's see you again next time.